also. Today, she is going to talk about a very, very relevant and important topic for all women, whether it is a young woman or an elderly woman, that is the menstrual pain or the menstrual cramps. She has been practicing gynecology for more than 35 years. She has been associated with Commonwealth Women's Association Medical Center, and she's here today to help us with all our questions. So I would request everyone out there, if you have any questions regarding to our topic today, please post them and we'll try and take it during the session. So thank you, Anita Dharji, for doing this with us today. Before that, to kickstart the episode, I would request Yogeshji to do the morning prayer.
Okay. Thank you, Sonali ji. Good morning, everybody. डॉक्टर के अग्रवाल सर की दिव्य आत्मा को नमन करते हुए आज हम यजुर्वेद से काफी यूनिवर्सल प्रेयर है जो आप सबने सुनी होगी, उसे करेंगे। ओम विश्वानि देव सवितर्दुरितानि परासुव यद्भद्रम तन्न आसुव। सब सुखदाता हे परमेश्वर, आप रचें जगती सारी, शुद्ध स्वरूप जगत के पालक, कृपा करो हम पर भारी। दुख दोष दुर्गुण दुर्जन को दूर बहुत ही कर लीजिए, हितकारी गुण कर्म वस्तुजन परमेश्वर हमको दीजिए। धन्यवाद। ओवर टू सोनाली जी।
Thank you, Yogeshji, for that prayer this morning. So I would present the platform to Dr. Dhar. Ma'am, over to you.
Good morning, everybody. After such a long time, I have attended this 8 a.m. session. I am very active and I'm really trying to stop my tears when I would keenly wait for this morning session for the lectures of Dr. Ca125 Agarwal, sir. So it's very painful for me to come at 8 a.m. session. I am not honestly coming at 8 a.m. session because this was a session for me where I would be, when I pitched in the COVID, due to certain reasons, all my questions which were nobody could answer, and I would listen to his lectures and most of my questions would be answered, which I remember, which are etched in my heart and brain till date, and I can confidently discuss with anybody. It's very painful for me. Anyway, as he used to say, we have to move on, we will move on and keep his legacy alive. Today, something different from the COVID I will discuss. I think enough has been discussed and enough will be discussed. Let me go to my topic, which I can share with you all people. And at the end, we'll take some questions as well. Everybody must have heard of the topic, which is girls or ladies getting painful menstruation, as Sonali ji told it. But in our language, we call it dysmenorrhea. You must have seen many doctors writing the diagnosis. When you go to a doctor writes the diagnosis of dysmenorrhea. So what is dysmenorrhea? I will discuss it in a very simple language so that all of you understand it well and you are able to help others in some way, one way or the other way before they reach to the doctor. You're able to guide them. I won't go into the details like I'm giving a lecture to doctors. It will be very, very practical. So I have divided it into certain categories. First, let me give you an introduction, classifications, what are the clinical features, diagnosis, and how you manage it. So the first would be introduction. If we could, is it possible to show the slide of introduction? Is it possible for you, Vamsiji?
Yes, ma'am, he's trying.
Okay, so let me give you, yeah, that's right. So in the introduction of the dysmenorrhea, which is painful menstruation, which we already discussed, it may be having in young ladies, young girls, or in reproductive area, or premenopausal, even when you reach, suddenly they start painful cramps. So causes of it are different in two groups. So introduction would be, everybody knows, painful cramps during menstruation. Now it affects all women. 50% of women can have this sort of pain, which we can cope up with. It is a simple mild cramps during the period when we start periods, everybody. So it's very common thing. Nothing to do about it. They don't need any treatment. Just period starts, this period pain will go gradually. Only about 5 to 10% have severe dysmenorrhea, where we are really concerned that what should be done, and we should not ignore that. The second would be, how do we classify it? Second classification, we divide it into two groups. One is primary or another is secondary. Primary is usually seen in young girls, and we don't usually find any underlying pathology. Means underlying कोई उनमें cause होता ही नहीं है. तो उसके बारे में हम ज्यादा बात करेंगे. उनमें कोई, बट उनको हम लेबल नहीं कर सकते कि ये प्राइमरी है जब तक हमने उनमें सारा रूल आउट किया है. Once we rule out, there is nothing we rule out. We say, diagnose it confidently that it is primary dysmenorrhea and treat it accordingly. Then the second part is secondary amenorrhea, which I was talking about. Secondary is those ladies who get in the reproductive age group after childbirth, or when they are coming near to their menopause, they are in perimenopause group. Suddenly they say our periods have become painful. There's which even less pain also they should not be getting, because they have produced children, they are nearing end of their reproductive period, but they come with this complaint. This should be taken very seriously, and something underlying is going on. We should be concentrating about, thinking about that, how to go about, but don't just ignore it. Pain ho raha hai, no, give her a tablet. Don't ignore it. This is a very important symptom of some underlying pelvic pathology. Next. As I said, there are two, primary and secondary. We will discuss first primary dysmenorrhea, how it presents. You must have seen girls who start their periods. When they start periods, young girls, say at the age of 11, 12, we call it menarche. When they start their menarche and all other sexual characters appear, they start, this is the normal journey of a lady, they start their periods. So first period or two periods, or maybe for 1 year or 2 years, they may have painless periods. Nothing happens. After 2 or 3 years or 2 years, their periods are so painful that mothers are really devastated what to do. They don't know, they don't understand how it suddenly happened. They think their daughters are having some terrible problem. That is why I thought this dysmenorrhea to present, painful cramps to present with you today, so that you also get an idea. Why they start suddenly? That means their periods are now become ovulatory. This is a clue for those also who are trying for pregnancy, and you can at once make out एक क्लू, इनडायरेक्ट क्लू आपको मिल जाता है कि ये ओवुलेट कर रहे हैं, इनकी ओवुलेशन, एग बनना शुरू होता है. शुरू के 1-2 साल जो होते हैं उसमें एक गर्ल जो होती है पीरियड शुरू होते हैं उसमें उसके ओवुलेटरी पीरियड्स नहीं होते. नाउ इट डिपेंड्स, किसी का 6 महीने, 1 साल, 2 साल, 3 साल तक वो पीरियड्स ऐसे ही रहेंगे और कोई पेन नहीं होगा. उसका मतलब है उसमें उनमें कोई ओवुलेशन हो ही नहीं रहा है. जब जो ही उनके पीरियड्स ओवुलेटरी हो रहे हैं, they start getting these severe cramps. And as I told you, this doesn't happen with everybody. This is only a group of the patients which comes in 5 to 10%. And these some cramps are sometimes so terrible कि उनको काम पे नहीं जा सकते हैं, कहीं पे नहीं. मतलब if you have seen, I'm sure आप लोगों में से काफी लोगों ने देखा होगा कि कितना severe pain हो सकता है. And ये symptoms usually they start just few hours before the periods and can last for 2 to 3 days. This pain can be colicky, cramping, radiating to legs, back, and some girls I have seen, those who come, mothers bring them, they are pale, which is because of syncope, nausea, vomiting, diarrhea. So all these symptoms, and mothers are terribly worried unless they are counseled. I'm sure after this, most of you will understand क्या actual problem है. So what do we do when such a girl comes to our clinics or presents? First is we give her some ordinary painkiller, just make her comfortable. Once she is comfortable, then we start discussing with the mother. She should be, our aim on this platform is that we should counsel and we should prevent. So we should counsel the mother as well, parents rather. Very normal, as I told you, that you must have started your periods, which are ovulatory in nature. Right from the beginning, they must not have been. So most probable cause is that it is a ovulatory period which you have started. You will start getting these cramps, but we can't label you primary dysmenorrhea. You need some few investigations to rule out other things. So diagnosis, please. Next slide. So as I told you before, we label this young girl, 17 years, 16 years, 18 years girl, जो ऑफिस से आती है, ऑफिस नहीं जा सकती है, उसकी माँ बेचारी बहुत परेशान है, खुद वो परेशान है, बहुत इंटेलिजेंट लड़की है, पढ़ाई कर रही है, पढ़ती है, लेकिन इस वजह से उसका काम छूट जाता है. बहुत ही बुरा लगता है हमें कि उसका काम छूट जाता है. So हम क्या करते हैं? It is an investigation in just 1 day or 2 days. हम उसका सारा कंप्लीट करते हैं. इफ वी नो कि ये क्या हो सकता है, अब बाकी कॉजेस हमने क्या करने हैं, विच आर रियली कॉजेस फॉर द सेकेंडरी वन, मोस्ट ऑफ देम. सो एक सिंपल उसका यूरिन टेस्ट एंड अल्ट्रासाउंड दैट विल रूल आउट ऑल दीज थिंग्स. डिफरेंशियल डायग्नोसिस कि उसके यूट्रस में फाइब्रॉइड तो नहीं, क्योंकि यंग गर्ल्स में भी फाइब्रॉइड हो सकता है. एंडोमेट्रियोसिस तो नहीं है. एंड रेयरली, कभी कभी हमें पता नहीं होता, हमें ऐसा भी मिला है कि पेरेंट्स को पता नहीं है, प्रेगनेंसी कॉम्प्लिकेशंस भी हो सकती हैं, जैसे अबॉर्शंस है, एक्टॉप, खास करके आज के टाइम में हमें बहुत ही केयरफुल रहना पड़ता है. पीआईडी तो नहीं है, यूटीआई तो नहीं है, कोई और कॉज तो नहीं है, जैसे एक्यूट एब्डोमेन का appendicitis और many other surgical causes. But aim here is that we don't label her as primary dysmenorrhea है, कुछ नहीं है, शुरू हो गया, दवाई का टैबलेट देकर भेज दिया. वो हमारा एम होना चाहिए कि हम इसको, जो हमारे दिमाग में है, कोई पेल्विक पैथोलॉजी तो नहीं चल रही है जो हमने सेकेंडरी के लिए बोल दिया, उसको रूल आउट करेंगे. अब हम यंग गर्ल में प्रेगनेंसी टेस्ट नहीं करेंगे. यंग गर्ल में ओनली एंड ओनली यूटीआई को रूल आउट करने के एक यूरिन टेस्ट करना है, पहले उसको कंफर्टेबल करना है, यूरिन टेस्ट करना है और एक अल्ट्रासाउंड करना है. दैट विल गिव अस कि सब कुछ नॉर्मल है. ओनली वी वांट टू सी हर यूट्रस के साइड में ओवरीज कैसी हैं. दैट विल गिव अस एन आइडिया कोई प्रेगनेंसी का तो नहीं कुछ है, बिकॉज आजकल के इट इज वेरी कॉमन कि अनमैरिड गर्ल्स many things every daily routine life we find out, but we can't offend them. Parents को भी offend नहीं कर सकते, उनको भी नहीं. So just by simple ultrasound, it do it. Once everything comes, in 99% of the patients, everything comes normal. There is nothing. So confidently we label it as primary dysmenorrhea in young girls. Next slide. Once we are sure about the diagnosis, and then we start telling parents what can be done, what is to be done. First is we reassure them. Reassurance, again, we tell them, look here, this girl has started menstruating. Now she is going into ovulatory phase. There's nothing to worry. And if a girl lifestyle changes, certain dietary changes, lifestyle changes, which all of you now have become expert, what are the lifestyle, non-inflammatory lifestyle changes, which includes diet, exercises, plenty of fluids, all those things first you discuss with the parents, with the girls. She should understand its importance. You should, if she is obese, you have to tell her how to reduce the weight. What are the two important things which always we have been talking on this platform every now and then, and that what things to be stopped: outside food, junk food, other things, because after all it's hormones only which is playing havoc in her body. So once she is reassured, I don't have, parents are reassured, so they are very happy, most of the pain is relieved, underlying kuch bhi nahi hai usme. Then how you have to really help her? How can you help her? By simple this mefaminic acid, ibuprofen, diclofenic acid. उसको बोल देना है कि ये जब पीरियड आपका शुरू होने वाला है, पहले दिन से ये दवाई शुरू कर लो. एक टैबलेट ले लो सुबह, एक टैबलेट ले लो शाम को, और पहले 2 या 3 दिन ले लो एंड फॉरगेट अबाउट इट. 2 दिन या 3 दिन लेने से कोई दिक्कत नहीं, एंड गो ऑन योर रूटीन. जॉब पे चले जाओ, काम करो अपना. ये तो 3 to 6 साइकिल्स में, ये लोग यूजुअली 6 साइकिल जब उनको देते हैं, ठीक हो जाते हैं. नहीं ठीक हो जाते हैं, इनको बोलो कंटिन्यू करो. अगर एक टैबलेट रोज की रहनी पड़े 2 दिन के लिए हर पीरियड में, इट डजंट मैटर. अगर मेफामेनिक एसिड लिया उन्होंने, एक तो ब्लीडिंग को भी ठीक करता है, पेन को भी ठीक करता है, एंड दे गो ऑन विद देयर नॉर्मल लाइफ. प्लस उनका जब आप रीअश्योर हम लोग करते हैं, लाइफस्टाइल चेंजेस वो कर लेती हैं, उनका पेन थ्रेशोल्ड भी बढ़ जाता है. जो ओबीस है, ओबीस वाली अपना वेट भी शेयर करती है, पहले let me tell you one thing. Obese ladies में यूजुअली साइकिल्स आर एनओवुलेटरी, उनमें ओवुलेशन होती नहीं, उनमें ये पेन इतना ज्यादा होता नहीं. इसमें यूजुअली आई एम टेकिंग नॉट ऑल द टाइम, यू विल सी थिन लीन गर्ल्स जिनमें ये सब कुछ होता है. सो उनको भी एडवाइस देना है कि पेन थ्रेशोल्ड उनका भी उससे बढ़ जाता है, उनको रीएश्योरेंस कि तुम में कुछ भी नहीं है. एंड अगर ये ठीक नहीं हुआ, अगर वो ज्यादा इंसिस्ट कर रही हैं, तो हम देयर इज वन मोर थिंग जो एक ओरल कॉन्ट्रासेप्टिव पिल, कंबाइंड पिल होती है. यूजुअली हम लोग वो देते हैं लेडीज में कॉन्ट्रासेप्शन के लिए, बट दिस पिल इज यूजफुल हेयर ऑल्सो. बट एट द सेम टाइम वी हैव टू काउंसिल हर पेरेंट्स, एंड दिस इज नॉट ओनली फॉर कॉन्ट्रासेप्शन. This pill is being given as a therapeutic, as a treatment in her case, so that we can suppress her ovulation. So we give her for 21 days. The periods she gets, those are anovulatory because her ovulation is suppressed. So relief हो जाता है. उसका ये पेन जो है 6 or 9 months, she will be fine. Maybe one mefenamic acid टैबलेट या ibuprofen टैबलेट वो दिन की एक लेने से वो just by a simple thing उसकी जो लाइफ मिजरेबल हुई होती, पेरेंट्स सोचते हैं इसको कोई यूट्रस पे कोई चीज है, कुछ है, वो सब ठीक हो जाता है. अब कुछ लोगों को हमने ये भी रिएश्योर करना है कि पूछते कब तक हम दवाई खाएं. भाई कुछ नहीं है, दवाई खा लो और आपका ये पेन खुद ब खुद ठीक हो जाएगा जब एक बार आप प्रेगनेंसी हो जाएगी और डिलीवरी हो जाए. प्रेगनेंसी में तो पीरियड्स ही बंद हो जाएंगे और डिलीवरी के बाद ये पेन खत्म हो जाता है. अब to give you slight idea, just it's not important for you because it was not a lecture for doctors. ये पेन होता क्यों है इनमें? ये पेन के काफी कॉजेस हैं. जब ओवुलेशन शुरू होती है, एंडोमेट्रियम की अंदर वाली लाइनिंग प्रोस्टाग्लैंडिन्स एक होता है, वो रिलीज करना शुरू कर देती है. किसी में वो ज्यादा हो जाते हैं तो क्रैम्पिंग हो जाती है. किसी की कॉन्ट्रैक्शंस, यूट्राइन कॉन्ट्रैक्शंस नॉर्मल से ज्यादा हो जाती हैं तो उनमें इस्कीमिक हो जाता है, वो कंजेशन, पेल्विक कंजेशन हो जाता है. तभी हम उन लोगों को बोलते हैं हॉट वाटर बॉटल ले लो, अपने लोअर एब्डोमेन पे रख दो और 1-2 दिन में सब पेन खत्म हो जाएगा. So this is about the young girls primary dysmenorrhea. Now एक और कैटेगरी आती है जो चाइल्ड बर्थ के बाद आती है. चाइल्ड बर्थ के बाद में जिनमें पहले हुआ ही नहीं है उनको शुरू हो जाता है. क्यों हो रहा है उनमें? हमने इस कंडीशन को हम लाइटली, दोनों में लाइटली नहीं लेना है, मगर इसको अलग से हमें सोचना है. जब दिमाग में कोई बात है तभी तो सोच सकते हैं. अगर दिमाग में कुछ नहीं है तो दवाई टैबलेट लेकर बोलते हैं कि चले जाओ. अब दिमाग में है कि इसको सेकेंडरी डिस्मेनोरिया, पेनफुल क्रैम्प्स शुरू हो गए हैं, चाहे माइल्ड है, चाहे मॉडरेट है, चाहे सीवियर है. इनमें यूजुअली यू विल फाइंड माइल्ड, मॉडरेट, सीवियर टाइप है, but which was not there before. How come it has started? If you have something in your mind, you are aware after today's lecture, no, you must think that something is going on in her, something has changed कि इसका पेनफुल पीरियड शुरू होने लगते हैं. जरूर वो ये बोलेगी मेरे पीरियड बचपन में भी होते थे, बट बचपन में होते थे वो तो डिलीवरी के बाद, प्रेगनेंसी के बाद हमें ठीक होना चाहिए, क्योंकि बॉडी की फिजियोलॉजी चेंज होनी चाहिए. हमें अपने आप को क्वेश्चंस पूछने चाहिए कि क्या हो रहा है. फिर उसकी हिस्ट्री बड़ी इंपॉर्टेंट है. ये लेडी कभी बोलती है मुझे पीरियड्स में अभी 1 हफ्ता या 3 दिन 5 दिन होते हैं तो आई स्टार्ट माई पेन. फिर हम एक्सपेक्ट करते हैं ये पेन जब पीरियड्स शुरू हो गए तो रिलीव होना चाहिए. वो बोलती है थ्रू आउट पीरियड्स रहते हैं. फिर ये बोलती है पीरियड्स के बाद भी कुछ दिन रहते हैं. तो यूजुअली ये लेडी बोलती है, जो हम यंग गर्ल्स का बोलते हैं पीरियड ऑनसेट शुरू हो गया तो उनका पेन ठीक हो जाता है, होने लगता है. इनमें ऐसा नहीं होता है. और इनको अगर हम ये चीज सब देते हैं, पेन किलर्स देते हैं.
अच्छा ये हाँ सही है ना, ऐसे आपको बड़े प्रॉपर्टी अच्छे वाले.
Okay, so इन लोगों में जो हम like we discussed in primary dysmenorrhea, NSAIDs and which is mefenamic acid, ibuprofen, this is useful, and if not we can use oral contraceptive pills, but we have a limitation. NSAIDs temporary relief के लिए दे सकते हैं. NSAIDs everybody knows it is mefenamic acid, ibuprofen like analgesics, but OCPs oral contraceptive pills का हमें limitation होता है, and इनसे भी इनको कोई खास relief नहीं मिलता है, क्योंकि elderly women में ये हार्मोन्स को हम रेस्ट्रिक्ट करते हैं. We cannot give because they have by then they have started getting hypertension or diabetes or obesity, so these are not recommended कि उनमें देखा जाए. unme now they need a proper investigation. Proper investigation, as I last time, sometime back, I discussed PID also. Only one investigation is very important, and which is ultrasound. Next, please. When we do ultrasound, definitely we get one of these following causes in her this uterus. This is the one of the causes because of which she is getting a dysmenorrhea. Number one is endometriosis, which we call in elderly adenomyosis also. And her ultrasound diagnosis will come as adenomyosis. Or she has a fibroid uterus, or she has some congenital uterine anomalies, but not really an elderly. That would have been detected early when she had childbirth also. But here I have mentioned it, that diagnosis would have been made much earlier. Or cervical stenosis, again, such diagnosis would have been made much earlier. But the three important diagnoses are adenomyosis, fibroid uterus, endometrial polyp, and PID. These are the most important diagnosis in the elderly lady. Always put in back of your mind, अगर वो बोल रही है, एक सेकंड अभी नहीं, अगर वो बोल रही है कि मुझे पहले नहीं होता था, अब होता है, पेन होता है और पीरियड्स भी ज्यादा हो गए हैं, ऑलवेज पुट योर माइंड कि एडेनोमायोसिस हो सकता है इस लेडी को फाइब्राइड यूट्रस हो सकता है, और यंग और एंडोमेट्रियल पॉलिप हो सकते हैं, पीआईडी हो सकता है, पीआईडी इज पेल्विक इन्फ्लेमेटरी डिजीज, कोई इन्फेक्शन है, या इसके अंदर अगर इसने कभी कॉन्ट्रासेप्टिव आईयूसीडी, कॉपर टी, मल्टीलोड, मेरेना कुछ लगाया है, इसको वो उसके कारण हो सकता है। यंग लेडीज में जो होती है उनमें ये दो कॉजेज जो यंग प्राइमरी एमेनोरिया में, sometimes there is cervical stenosis, means opening of the uterus is closed. Sometime later I will discuss a case which is one recently, I won't name, I will discuss. I had a such case where there was this really suffered. She was 14 years old. Now she is doing fine. So we see such cases. It's not that we write only. But what I mean to say is congenital uterine anomalies and cervical stenosis would have been diagnosed much earlier. So elderly lady, which starts, always you should think of, या तो इसके यूट्रस में तो कुछ चल रहा है, एडेनोमायोसिस एक डायग्नोसिस है, वो क्या है आपके हाथ में नहीं है, लेकिन अल्ट्रासाउंड में पढ़ोगे है ये डायग्नोसिस, फाइब्रॉइड है, कोई पॉलिप्स अंदर बने हैं एंडोमेट्रियम में, पेल्विक इन्फ्लेमेटरी डिजीज है, या इसके अंदर उसको पहले हिस्ट्री पूछनी है, आपके अंदर कॉपर्टी या मल्टीलोड तो नहीं लगाया है, दैट कुड आल्सो गिव दिस सॉर्ट ऑफ spasmodic and dysmenorrhea, painful cramps. Next. Now I told you that it is very easy to diagnose. Diagnosis is mainly done by when we put a hand on her abdomen or do internal examination. Many things we come to know कि क्या problem है इसमें. Just by our hand and one internal examination gives us clue कि क्या है. Then how do we confirm this diagnosis? Ultrasound will confirm the diagnosis. If we are still in doubt, which rarely we need, we may need laparoscopy, hysteroscopy, or other scopies, which you shouldn't be bothered about. But main two tools of diagnosis are 19% diagnosis by abdominal by using our hands and by doing internal examination. History say, diagnose, ultrasound say, we can tell 99% of the things what is happening around. And ultrasound will confirm our diagnosis, not more than that. Then what is the treatment? Next. The treatment is, of course, to relieve the pain. We will be giving some analgesics, and then obviously treatment is of the underlying cause. If she is a young lady, she has adenomyosis, we will give her some hormonal treatment and wait, see how she is doing. If she has completed her family, there is no, then this lady definitely needs removal of the uterus. And if fibroid uterus, again, we try first, or maybe this fibroids will shrink. Always we try first hormonal treatment. If it doesn't work, then it will be removal. Hysterectomy is the last resort with us. So I hope things are clear. If you want to ask me anything, you can ask me questions.
Ma'am, we have a few questions, I think.
Yes, sure, please. Happy to answer. Yeah.
Ma'am, Anshuji is saying that she's requesting us to take a session on menopause and its side effects sometime.
I think I took in one day. I took. I can take again. I think menopause, perimenopause or menopause. I have taken it 2 p.m. session with Chawla ji. So I don't mind taking. I don't mind taking it again because these are very important, relevant topics. I can take it again. No issue. I can take it again.
Ma'am, Kavita Bangarji has a question. She's saying she's 38 years old and since long she's having heavy bleeding and painful menstruation cycle. Last 4 months back, she had severe fungal infection. So doctor advised sonography and it shows some cyst in the ovaries. And they've given for 3 months, but now cysts have become very tiny, but they will come again and some swelling is there. So what to do for that? So I think she needs to be investigated. So we can request her to join the OPD, ma'am.
I think if they join OPD, I will see all the investigations and give me a day. I will see gynec patients. Definitely, I will advise her. Does she have children?
Ma'am, we'll have to ask her. Kavita Bangaji, if you're present in the session, can you please answer? Or we request you to join the OPD from 3 to 5.
I'll send the link on her Facebook.
Okay.
And continuation, there is one more question to her.
Yeah. Ma'am, she also did a Ca125 test and it comes 36 after 3 months again. She has been told to do the same test.
Yeah, this is interesting. I would look. I got the clue what she has, but
Okay.
I can't ignore her and I can't tell her here. I got a clue what she is. There is definitely some underlying cause, as I told you at this age. But only my curiosity is, does she have children or she doesn't have children? If she has children, I got the clue what she has. So
Okay.
I would be happy to discuss this case with her in the OPD whenever she joins OPD. I can do one gynae OPD every week. There is no problem. Such patients can come and I can give them a fair opinion how to go about this and what to do about it. And clear all her doubts, which till date nobody must have cleared her. That is counseling and what all to be done, how to go about it.
Shivani ji, can you please post this to her? We hope she joins the OPD then.
Yes, Sonali ji, she has already messaged me and I've given her the link. Thank you.
Okay.
When she agrees to join, when these people join, give me in advance, tell me that because I'm also busy, I will keep myself free and do one session, or you decide, I will do one session gynae OPD, which I can do any day, anytime, 3 to 5, anytime I can do, she can do that session.
Dr. Anita Dhar, whenever you are comfortable the day, we will fix the day. And if we have patients, we will call you on that day only.
Yeah, my little lighter days are Tuesdays and Thursdays.
Okay, so you're comfortable on Tuesdays and Thursdays.
Thursdays afternoon. These are my lighter days. Yeah.
Thank you. We'll put a note on that.
Okay.
Ma'am, Vamsi ji has another question. What can be said as a normal pain level and when to consult a doctor?
You see, normal pain level is which is she talking of primary or elderly or young girl?
It's a general question, ma'am.
Mild is that mild cramps, everybody, you, me, everybody can get mild cramps. That is it. When you will always know that this level never used to be before. This is always, it differs from patient. We can't say कि ये इसके लिए इतना इसके लिए, क्योंकि pain threshold is different for everybody. So when you feel it is deviated from normal, there is no harm in consulting a doctor. There's no harm consulting him.
Okay.
Consult, at least we will give some opinion. Avoid to ignore things. Never ignore things.
Okay. Ma'am, we have appreciation from Keshav ji that it was an excellent session. Then we have Yogesh ji asking what is the best contraceptive after first delivery at the age of 32?
I would suggest the best contraceptive, if everything is fine, I would go for intrauterine contraceptive device. Because at 32, there are multiple contraceptions, but if you want to be sure, barrier method has failures. Oral contraceptive pills have their own side effects, but 3 to 6 months doesn't matter. If a lady is lactating, we can't give them. if lady is diabetic, so I would still vouch for intrauterine contraceptive device. But at the same time, I would say once we put IUCD, what you call copper T, multilode, Mirena, whatever, have a regular follow-up. Don't just put it in and ignore it. We don't see ladies back after सालों के बाद वापस मिल जाती है, वो ठीक नहीं है. If you have a regular follow-up after 3 months, again with a simple ultrasound, see doctor and finish it off. That would be the best from my side. Though failure is with everything, but still I consider at this age, this is the best one, without any hassles.
Okay, thank you, ma'am. Another question is from Nidhi Sandhwani Diwan. She says that she's 35 years old with 2 kids and healthy pregnancies, but उनको कुछ irregular periods की problem है and hormonal medicines भी ली हैं, but वो ठीक. Please suggest something. One second, ma'am. Please suggest something. और मुझे near periods lesions होंगे, लगे हैं mouth में और hands पे. I think she also needs to consult you in the OPD.
समझ नहीं आया. हार्मोनल ट्रीटमेंट एराटिक नहीं लेना चाहिए. हार्मोनल ट्रीटमेंट्स के लिए हम लोग जो वही मैं नहीं बोलूंगी सब करते हैं. Usually doctors, chemists and here तो everything is available freely without any prescription. If you take wrong hormones, they come with their own side effects. We should be taking proper hormones. That depends upon the ultrasound diagnosis. What is your ultrasound diagnosis? Accordingly, your hormones. Like मैंने adenomyosis बोला है, या हमें प्रोजेस्टेरोन हार्मोन्स मिलने चाहिए. तो उस टाइप में अगर हम ले लेंगे, अगर तो कोई अंडरलाइंग और कोई पैथोलॉजी नहीं है. बट अगेन इफ शी कम्स टू ओपीडी, आई वुड गिव हर फर्दर सजेशन कि क्या करना चाहिए, कि कैसे उसको जाना चाहिए. बिकॉज एज आई टोल्ड यू, नथिंग इन लेडीज शुड बी इग्नोर्ड. We should be having in irregular periods always pap smear should be always and always included. Then ultrasound finding is very important. It should be reassessed, endometrium thickness kitna hai, and uske accordingly we should not go blindly on hormonal treatment. Once we are satisfied in our mind, yes, this lady can go on hormonal treatment, we should do hormonal treatment.
Okay, ma'am. Thank you so much, ma'am. Thank you so much. I think we don't have any more questions for now. So we would like to end this session with a big thank you to you, ma'am, and such an eye-opening session today for all of us. 1 second, ma'am. Vinduji is writing something. Would like to know. Vinduji, can you write a little faster?
Anshuji raised hand.
Yeah, Anshuji is raised hand. Anshuji, boliye.
Ma'am, I would like to thank you so very much for this session, ma'am. It was very useful and informative. And I have a question for my daughter. She has PCODs. So just every time the doctor has given her Diane, and will she have to take it for life? Because after she leaves it, her periods are not regular, ma'am. So will that carry on for life?
No, you see, PCOD is a complex. Only Diane will not help. What is her weight?
Ma'am, she's around 48.
48. Anshuji, if you join me, if they fix OPD for me, if you join me in OPD, I will give you a plan for the PCOD. What is the plan? You should understand what the problem is. Basically, parents and doctors don't have time to consult ki kya hai. You should be knowing what is PCOD. Once you understand ki PCOD kya hai, आपको खुद समझ आएगा. जब मैंने स्टार्ट माय ओपीडी, जब भी कभी गायनी पेशेंट्स हो जाएंगे, bring your daughter, not a daughter, though she also should be there. So I'll put in her mind कि क्या है PCOD, what is PCOD, कि what happens और कैसे होता है, what should be done. It is a complex thing. It's a vicious circle. But mothers and children are happy कि हमें diagnosis मिल गया, PCOD मिल गया diagnosis. But don't blame everything to PCOD. Diane से सब कुछ नहीं हो जाएगा. It's a complex thing and so many things have to be followed. Very simple things. That is the counseling part where it works. So I will be very happy to do it for you and your daughter in the session in OPD.
Okay, thank you so much, ma'am. I will be in touch then.
Sure.
Thanks.
Ma'am, Shivani ji, please ask your question.
Yes, and Dr. Anita, the question was that we are asked to done that Pap smear. So Pap smear should be done when, and what is the signal of it?
What is the?
matlab when we should do it, as after which age, and if there is any issue, so when we should go for it again for the Pap
Yeah.
smear.
You see, I'll tell you here but this is very important question. Thank you for putting this question, because I am very fond of, maybe I'm of old school of thoughts. I am very fond of this Pap smears. Pap smear is a very simple test, but gives us lot of information about many things. It gives us lot of information. Even if nowadays recommendation, because you have seen the age for every disease has come, which would happen in 80s and is happening early. Now we recommend, at least I recommend it, and what in United States they do is that from the age of 30 के बाद करना चाहिए. Now you will ask me कि आप क्यों 30 के बाद करते हो? There is a reason, because I am not in favor of those injections which are given cervical malignancy को देने के लिए. आजकल you must have seen those injections are very common and should be given. I am not saying should not be given, but there are two types. Those injections are exactly like COVID injections. We don't know which strains they are covering, and in spite of giving those injections, HPV इंजेक्शन जो सर्वाइकल मैलिग्नेंसी के लिए यंग गर्ल्स में दिए जाते हैं 2 इंजेक्शन, देयर इज नो गारंटी कि सर्वाइकल कैंसर नहीं होगा. एंड ये टेस्ट जो है ये उसी के लिए है, सर्वाइकल कैंसर को देखने के लिए, और इससे हमें इतनी इंफॉर्मेशन मिलती है दैट इज आई कांट एक्सप्लेन. एटलीस्ट आई कैन टेल यू माय दिस के वी गेट माय एक्सपीरियंस. Even if we do it every year, 30 from the age of 30 years, what is the harm? Simple test, आपका गायनेक करेगा, pathology report मिलेगा, you are satisfied. Isn't it a simple test? Why not to do it? It is not invasive test. It's very simple test, but provided doctors tell you हाँ भी, but they will go after injections लगा दो. That is more commercial part, क्योंकि 2 injections आप लगाओगे 28-56 हजार के मिलेंगे. That is more. जबकि 500 या का टेस्ट या 1000 का टेस्ट होगा, this will give lot of information. And I am against injections. I prefer to do the Pap smear on my patients always, wherever I have done camps, wherever I do, wherever I work, whether it is affluent feature for people, I'm fond of this Pap smear. So answer to your question is anytime after 30 years it can be done.
Okay, and Dr. Anita, there one more thing about it. When how many duration time? Suppose I have done last year, so the next should be when? It's every year, or it should be alternate?
If you don't have any history in your family, no malignancy history, but still I would say कि यार करा ही दो, एक बार करने में क्या हर्ज है, कोई दिक्कत ही नहीं है कि आप, दिस इज नॉट अ बिग टेस्ट. ये तो जस्ट आए, हमारे ऑफिस में होता है, ओपीडी में होता है, आके कर लिया तो चले गए. मुझे पैप स्मेयर कराना है तो रूटीन पैप स्मेयर. आपके पास रूटीन और भी कोई इन्वेस्टिगेशन कराना होगा, सीबीसी, टीएसएच, ब्लड शुगर कराना, उसके साथ इसको भी कंबाइन करो. कुछ रूटीन इन्वेस्टिगेशंस तो 1 साल में करा ही लेते हैं हम, जैसे सीबीसी है, टीएसएच है, ब्लड शुगर है, ब्लड प्रेशर को चेक करते हैं, ये तो हम रूटीन में करते हैं. और कोई होगा ज्यादा कॉन्शियस, अल्ट्रासाउंड भी करेगा, इसको भी इंक्लूड कर दो.
Thank you so much.
Binduji, please ask
Yes,
your
Gandhi. So, good morning, ma'am. I just wanted to ask you, like, I mean, since we are into a menopausal stage, since I'm 48 years old, so what is the frequency since of the ultrasound should be maintained? And because the pap smear you said should be at least once a year. So if we do not have any history, so you would recommend the ultrasound also to be done
Yes.
every year?
Yes, I would recommend pelvic ultrasound every year. Not a big deal, especially if you are perimenopausal. You do ultrasound, pap smear ko, basic investigation, CBC, TSH. If you are not obese, if you are obese, also lipid profile, then your pap smear, it should be included. And if you have any family history or anything, then I would recommend one baseline, even if family history or no family history, one mammogram I would include at the age of 48.
Okay, so this has to be repeated yearly, you mean to say?
No. Mammogram, you need not repeat every year. That can be done once, then after 50 years again. Sorry, 5 years, sorry.
Okay, after 5 years, right, ma'am.
Unless you have any history, family history, but mammogram को एक baseline रखना चाहिए 48 पे. This is the screening and prevention. देखिए इस platform पे हमने हमेशा यही सीखा है सर से कि prevention और उसको आगे के लिए होने नहीं देना है. बाकी is in the hand of gods that we can't, certain things we can't stop. I have seen ladies getting malignancy between 2 mammograms. एक अभी किया, एक अगले साल कर लिया. But at least no regrets हमने नहीं करा दिया. So every year एक baseline रखा, फिर 5 साल के बाद किया. Pelvic scan तो करने में कोई दिक्कत नहीं है और कुछ basic investigation 1 साल में अपने आप को करने में इतना कुछ करते हैं. Awareness होना चाहिए. You should be aware of the things that what are the most common. Like thyroid is so common. So what is like TSH कराने में you lose nothing, every year करने में nothing. CBC को देखने में nothing you lose. यूरिन एक भी इंक्लूड करोगे तो बहुत अच्छा रहेगा. और अगर आप ओबीस है तो लिपिड प्रोफाइल को करो, वरना नहीं हाइपरटेंसिव है तो बाकी चीज थोड़े बहुत भी KFT भी करो, otherwise no need.
Right, ma'am. Thank you very much, ma'am.
Thank you, ma'am. I think Anshuji will take your last quick question because Shashiji is here for the Gita session.
Yeah.
Yes, thank you, ma'am. Ma'am, I need to inquire about this, the cervical, you have an injection that one gives to the teenagers. So how soon can you give it just to prevent cervical cancer, ma'am?
If you have listened to earlier question, I said I am not in favor of giving these injections. I have my 2 daughters. I have not given to them.
Okay.
So there are 2 thoughts. Someone in favor of giving, I am not in favor of. I means if लोगों को लेना है ले सकते हैं, but I am not the one prescribing them because I feel मेरा जब आप OPD में आएंगे मैं अपने opinions आपको बताऊंगी कि मेरा क्या है, but that doesn't mean लोगों को लेना नहीं चाहिए. I won't stop. I won't criticize those doctors, those who give. But I am not convinced and I am not throughout my experience. I don't think हमें उसका कोई इतना डाटा है कि उन्होंने आज तक कोई सर्वाइकल कैंसर प्रिवेंट किया है.
Okay, all right.
पैप स्मेयर ने काफी इंडिकेशंस हमें देता है. पैप स्मेयर से हमें बहुत डिस्प्लेजिया वो चीजें क्या क्या हो रहा है. पैप स्मेयर इफ डन नाइसली, पैप स्मेयर करने वाला भी ऐसे होना चाहिए जिसको पता है मुझे पैप स्मेयर कहाँ से लेना है, 2 सैंपल्स उसको लेने होते हैं, मुझे कहाँ से लेना है. इफ डन नाइसली बाय समबडी, इट गिव्स अस लॉट ऑफ information.
Okay, all right. Thank you, ma'am.
Thank you so much, Dr. Anita, for doing this with us. And I think all the women on the platform today have benefited from your session today. And we've got many more questions, ma'am. We'll definitely join the OPD and ask you questions.
I will, before you give to Shashi ji, I would like to know, I think tomorrow also I am giving lecture. Tomorrow is my okay. I have given one, sir, menopause. Do you want me to ask general opinion? Do you want me to talk about menopause or something tomorrow? Do you want me to talk about that?
Dr. Ma'am, Sonalaji will speak to you offline.
I'll speak to you
Let
offline.
me do in advance because I have also to do some homework to make it simple. Okay.
Thank you so much, ma'am. So we'll end this session and look forward to your session.